Welcome, and thank you very much for joining me again. My name is Swartik Mayanja, and this is the Mayanja Accredited News Network. We are on another episode of my Everyday Hero interview series, where I interview someone in your life or someone in my life that makes us smile but does not get the credit they deserve. Today, I have the honor, the pleasure of interviewing a very, very, very confident, great nurse, someone that works with me at Health South, Paige Trainer. Thank you very much for joining me. Welcome.
Thanks for having me.
Of course.
There is no justice when so few have so much and so many have so little.
So it's your day off. Congratulations. We have a day off from that craziness of what we call work.
Yeah.
So just tell us, tell me and tell the people, who are you, where are you from, and why nursing?
So my name's Paige. I grew up in New Jersey. I actually found nursing by accident. Believe it or not. Mm-hmm. Yeah. I went to Northeastern. I did the co-op program, and I was originally a bio major. Did my co-ops, and it just was not what I wanted to do. And my advisor said, try a nursing co-op. You've got clinical experience. I was an EMT at the time.
Oh, wow. Okay.
So I had a little bit of experience, and they let me do a nursing co-op, and I was obsessed with it. I loved it.
Wait, I'm sorry. So you were doing bio, and they let you do a nursing co-op?
Yeah, because I had the patient care experience as an EMT.
Okay.
So they made an exception.
That's awesome.
So I ended up graduating with bio and doing the 16-month nursing program through Northeastern. So I did. Oh, it was
tough.
It was wild.
That's rough.
That was
We'll get back to that.
Yeah,
that's a little.
was rough.
I'm sorry.
But yeah, it just kind of I stumbled upon it and fell in love, and I was like, this is what I have to do for the rest of my life.
So prior to you not wanting to do the bio and doing the nursing co-op, you had no idea, you had no intention of ever doing nursing? Oh, wow.
No clue.
Okay, and you said, where'd you grow up?
New Jersey.
New Jersey. So you're new to Massachusetts?
Yeah, I moved up here 2009 for school and never left.
Wonderful.
Yeah.
Welcome to Massachusetts. I'm sorry about the people. So the reason I'm interviewing Paige is because when I first started at Health South, I was very nervous. I was very scared. I didn't know how to be a nurse. And Paige just seemed like the most confident nurse I have ever seen in my entire life. She would walk down the halls and people would part way. It was great to see a nurse with so much confidence. Paige, how did you get there? But before that, how long have you been a nurse? And then tell us, how did you get from being a new nurse to being a great nurse?
So it was actually my nurse anniversary last week.
Congratulations.
1 year. But the confidence thing, I think, just has to do with kind of who I am. I've always kind of been that way. But I think the biggest thing that helps me in that first year was knowing I know what I know, and I know what I'm good at, but I know what I don't know and when to ask questions. And I think that's the difference between someone being sort of a good nurse and a great nurse, because you're not still afraid to ask for help.
Yeah. So that's like where I struggle with. I feel like if I need help for anything, obviously I'm not good, right? So that's what I always, conflate the two.
Yeah.
I feel like if I need help, I'm not good, but if I'm good, I don't need help. So you just know when you need help, and you always ask. You don't, you fudge around it, you don't play around it, you don't try it yourself, you just go ahead and ask.
Right. And certain things, you do make game time decisions.
Yes.
Like if you get this really weird wound and you've got to think on the fly how to dress it, things like that. But so we got the LVAD patient.
Yeah. That was big news. That was, the whole hospital news.
Right. So I'd never worked with an LVAD patient. I'm a spinal cord nurse. I do spinal cord. I don't do cardiac. So to be confident in that situation, I was like, I sat down with John and Amy, who's my charge nurse and the nurse manager, and said, give me literature. I don't know a whole lot. Give me journal articles. Give me the policies from the hospital. Give me any little bit of information that I can so I can go home and study it. Because if I had walked in there and just been like, yeah, I can handle an LVAD, it would have been a disaster. Right.
That's a big no-no.
So I think the big thing to do there is to just know when you can kind of wing it and when you truly do need to ask for more information, and there's nothing wrong with that.
Oh yeah. So So you just said that you're in spinal cord, but you had an LVAD patient. Did you want to? Is spinal cord something you were looking into? That is there a type of nursing that you wanted to do? / is spinal cord it?
I love spinal cord.
Yes.
I don't know that that's necessarily what I want to do forever. My ultimate goal is to be in an ICU.
Oh, come again?
ICU.
Okay, ICU. Yes.
Yeah.
Yes.
But I ended up. Cardiacs just scares me. And it does.
Scares a lot of people.
Right.
Yes.
And I think when I decided what floor when I was in new grad, I was like, I think I'm going to be overwhelmed with cardiac. And I think spinal cord is more my flow. It's more ortho. It's more the type of things that I like to do. I get a lot of wounds, which I really like, which is kind of gross.
That is kind of gross. We have to differ there. Let's stay away.
But I think I get a lot more of what I like to do on the spinal cord floor.
Yeah. So I floated once on your unit, on your floor.
I remember that day.
My goodness, is it a lot? And I didn't have a tough assignment. It was just like, your regular, 5-6 patients. But my goodness, like going from one unit to another is just, it's
overwhelming.
It really is overwhelming.
It is.
And it's tough. Like the big things are the same, like just big general nursing things are the same, tasks, assessments, all that good stuff. But it's the little stuff. It's like, when there's different INOs, there's more people on your unit that would be doing taking a certain drug that I've never seen before. And I have to look that up, and just the codes to the med room and the codes to the break room.
And the little things that kind of just they fluster you throughout the day.
Exactly.
But I will be honest with you, Q, if I had floated to your floor, I would feel just as out of place and overwhelmed and a fish out of water.
Okay, that makes me feel a little bit better.
No, it definitely would. Because I don't do stroke patients. I don't deal with that kind of stuff on an everyday basis. So you would kind of be guiding me around on your unit.
I love my stroke patients. Okay, so you talked about asking for help. And I know communication is huge in nursing and just in healthcare in general. So asking for help from another nurse is one thing. How do you go about talking to doctors, to PT, OT, and then especially, this is super hard for me, talking to aides or PCPs. I just don't know. I just have a hard time telling people my needs, my wants. I feel like I'm overstepping. I feel like I'm not, advocating for the patient. How do you do that?
So when I was in nursing school, I actually worked as an aide. And the thing I learned most from the nurses that I looked up to was that they never, yes, they were telling me what to do, but they never made it seem like they were telling me what to do. They always phrased it as, hey, can you help me out? Hey, do you mind doing, taking room 22 to the bathroom? Hey, do you mind setting me up for an IV? So of course I'm going to say, yes, that's my job. That's what I'm here for. But it was never like, you need to do this and you need to do that. And it creates a friendly environment.
Oh, definitely.
So that now, I try really hard when I ask for help from one of the aides. I'm like, hey, Pat, do you mind taking this patient to the bathroom for me? I really, really appreciate it. I have to go do an IV in this room. So, and it comes across, it's more genuine. And I think it's less of a, well, you're the aide, so you have to do this. It's like, we're a team.
Exactly.
We all do this together.
Exactly.
And we all pitch in and help each other out. It's just, I have to do something that's a higher priority right now.
Definitely. And I worked as an aide, but I worked at assisted living. So I only dealt with one nurse, and she was the head nurse. And it was very, very much so like these are the tasks that you guys need to do. And it was 8 or 9 of us aides for the one nurse. So she was very much delegating and a lot. So when I started as a nurse, and it's very different ratios and different situation, I just had a hard time. I just get not nervous, but I feel bad asking.
You're uncomfortable.
For help.
Yeah,
exactly.
It's uncomfortable
to ask someone to do something that for my patient and so on and so forth, because they also have a lot on their plate.
It's true.
But with that communication, so with the doctors, with the PTs and the OTs, that communication, how do you deal with that? Because that's also something where I just get nervous.
I think coming at it as a conversation. As an open conversation that you're having about your mutual patient, because at the end of the day, the doctors, the PTs, the OTs, the nurses, we all have the patient in mind, and the patient is the priority.
Definitely.
So I think if you come at it as an open conversation, you get a lot more out of whatever it is that you're asking for.
Of course.
So if you say to the doctor, okay, I noticed Mr. So-and-so's not looking too good. His coloring's off. Like, I worked with him yesterday and he was way brighter. Do you mind taking a look at him?
Yeah, so that's definitely good on that, like dandy. But like what I get super nervous about is if I disagree with something that any of those people are doing. So that's when I get super scared, and like I'm like I need to say it because it's for the patient, but then at the same time,
My trick is you've got to have that like key phrase. So my phrase is always, I see your point, but I think. I'm just not feeling it. I think this might be something we might want to consider.
Yes.
So you acknowledging that their opinion and that what they're saying is valid,
of course,
but you're also bringing what you have to the table.
Definitely. And then
that takes them off the defensive, I think.
And I like that a lot because I never know what like to do instead of what the order is. Or I mean, sometimes I have a suggestion, but like I'm not going to say that I'm right, that this is where we should go. But I'm always just like I want to put other ideas in there, and I think that's a really, really, really good way of going about it. So you've been a nurse for a year. Congratulations.
Yes, thank you.
So I know I've been a nurse for 6-7 months now. The first 3.5 months ish was just super stressful, just
terrifying.
It was the worst thing
awful.
ever, right?
It's so awful.
And I'm just starting to like it. It's just
you're starting to calm down.
Exactly. So, do you enjoy your job, and what about it do you enjoy the most?
I love my job. I think I'm very, very lucky to be at my age and have a career that I'm so in love with and that I'm so passionate about. I know a lot of my friends are kind of still struggling to find that. But it's really, as kind of cliche as it is to say, about the patients.
Definitely.
I love every single one of my patients. I think they're the greatest, and it's like a family. Some days they push that call like 78 times and they're driving me nuts.
Oh, forget about it.
But then, one day they look at you and they go, Paige, thank you so much for everything you do. And I'm just like, let me go sit in the back room and cry for 5 minutes because that made me so happy.
It is. It really is some of like the best feeling goodiness that ever. Like yesterday, I didn't work yesterday as well. And I knew one of the patients that we've had for about a month, maybe 3 weeks, was leaving yesterday. So I just called and I just talked to her on the phone. It was like the best thing ever.
And it makes her day, it makes your day. And what an honor it is to be part of this journey with someone.
Exactly.
And it's, you're with them at a time in their life where they are not at their best and they're so vulnerable and they're so, they need your help. And to be the one that gets to be there for them in that moment, I think is very empowering. It keeps you humble.
Definitely.
And it really makes you feel good as a person to say, this person trusted me to help them.
Exactly.
And it's a huge deal. And sometimes I don't have a choice because that's the assignment you get that day. Don't. To just be with someone at a time that they're just so dependent on somebody else and to be able to give them the best care that you can is an honor.
I mean, I love the way you phrase that because it really is an honor on our part, right? So like they're in the worst situation they've ever been in, and they're out of rehab. In our case, they're out of rehab, getting better, but they're still in a really, really tough situation. Super vulnerable, and they're out there for the world. And you just come in there, and you help them out, and it's pretty great.
I think rehab nursing is way more vulnerable than people think. Because they're at the point where they're coming to rehab and they get there and they're so excited and then they realize how hard it is. So you get that dip where they almost are like, I can't do this.
Oh my goodness.
I want to go home. I'm so tired of this. So to be with a team that's like, no, come on. You can do this. You got this. You are going to walk out that door.
Day in and day out.
Right.
Minimum
and then
of 3 hours.
Right. And then they do walk out the door. And they're so happy and it makes it so worth it.
It definitely does. It definitely does. So on that same note, so we love our patients.
We do.
How do you deal with the family? The families, so, they can make or break my day. So how do you deal with the good and the worst of the worst families? And not the worst, but I'm not saying worst families. I'm just saying, families that get you going.
It's in the moment. I gotta walk off into the med room for a second and just take a deep breath and be like, okay, like re-center yourself, girl, because you're about to go off.
Yes.
And this is not okay. But I think the biggest thing is putting yourself in their shoes. As if it was my grandmother or my father in this rehab, especially because I'm a nurse.
Exactly.
I would be the biggest pain in the butt family member. I know I would. I know I would.
At least you're honest.
Yeah. Oh, and I know I'm going to be
honest.
the worst patient. I'm going to be the one that you need all safety all the time because I'm going to be trying to do whatever I want. So I think just remembering they're stressed out, they're exhausted,
Yes.
they're on a short fuse, and they love this person so much that I almost take it as if they're being a huge pain in the butt, it just means that they love their family member that much more. Granted, if they're being a pain in the butt about getting a cup of ice is one thing versus like, okay, why is my family member's care being done this way? And I think a lot of it is a lack of information on their end, something they don't understand. They don't understand why we're doing the interventions we're doing. No one explained to them, hey, your dad's labs were off. This is why we gave him an IV and are giving him fluids. Exactly. So I think a lot of diffusing the situation is educating the family members as to why we're doing what we're doing.
And I don't know if this is like a stereotype or this is just the bubble I lived in, but coming into nursing, I always thought the families that had the doctors, the nurses, and all that would be the crazy, I can't stand those patients. But I really do like my family members to be super informed because then they know everything, right? And it's just easier, just not like explaining stuff, but like, it's understandable, and you don't have to go through a whole process of education and stuff, but like they ask questions that, matter, not like any questions don't matter, but questions that are relevant to the patient. Right. So I think that's a big go. So back to your confidence as being a good nurse. Do you ever compare yourself to the coworkers, to the other nurses, to the the supervisors, to the just the nurse manager? Do you ever do that? Like, I need to be that good, or is that not a thing?
It's not a compare as much as a goal.
Okay.
I look at really strong nurses on my floor. I look at really strong nurses on your floor and on the cardiac floor, and I just think to myself, okay, what are they doing? What works for them? Can I take some of that? Because this is a goal. I want to be like you. It's almost like a mentor feeling versus like, I'm not as good as them. It's like they've been a nurse for 20 years. Of course, I'm not going to be, as on point as they are. But I'm going to work damn hard to get myself to be as good as they are.
So it's definitely a goal, and it's not so much competition. Yeah. Yeah. So because I'm just, I don't know if it's, just the testosterone in me, but I'm always like, oh, I need to be that good. I need to be that good.
But that's a good thing.
Yeah.
Because it pushes you.
It definitely does. Sometimes a little much. But, so we there. So you mentioned earlier skilled, and you said IVs. IVs are the scariest and the hardest thing ever. As of right now, I am 1.5, maybe 2 if you're being generous, for like 11.
But that's okay.
I hope it's okay because I'm getting really sad.
You have to practice.
Oh, goodness.
Practice makes perfect.
Yes.
Number 1. Number 2, don't forget the patients that you're trying to get these IVs in. They're dehydrated. They're elderly. Their veins are like paper.
They definitely are.
Yeah.
They definitely are.
I still miss.
Yeah.
Right now, I'm not going to lie to you. I'm on a dip. I'm 0 for 3 yesterday.
Oh, no.
Yeah.
I'm sorry.
So, but it happens.
Yeah.
You just got to get back on the horse.
And that's like the hardest thing because like when I first started, I was like, I gotta go. And then I missed like my first 5, obviously, right? And then I hit 1 and I'm like,
yes!
I'm an IV nurse. No, you're not an IV nurse. So I hit 1 and then it was like another 3 that I missed and I hit 1. And then since then it's been all misses. So you definitely get depressed. It definitely gets depressing, but it's okay. Skills other than IVs. You said you like wounds. But are there skills out there that you really, really, really want to hone, or are there skills that you like? I need someone to be in the room with me.
Definitely. Anytime I do something for the first time, I want someone in there with me. So I mentioned the LVAD patient earlier, which for those of you that don't know is the left ventricular assistive device.
Thank you.
Which is essentially, it almost looks like a battery pack that a patient will wear sort of on their waist. and it manually pumps their heart for them. So
Kind of badass.
right. So you have to be responsible for switching out the batteries on this thing.
Oh my. Okay.
Correct.
How often does that happen?
The batteries last 4 to 6 hours, or you can plug them into the wall.
So
But
this
if he's on therapy for 3 hours and he's moving around and using more battery power, I've got to be able to get in there and just 1, 2, 3 switch them out. So the first couple of times I did it, I can guarantee I had Amy with me, who's the charge nurse, and I had one of the nurses from 2 North over there, just in case, because I was like, oh.
Well, I mean, so like anything new to you, you say like, I need help.
Yeah.
Until you feel comfortable.
Right.
Wow. Paige, another really scary thing for new nurses, and something a lot of people, not even new nurses, every nurse in the world is scared of a code. Please. I've only been to 2 codes in my time at Health South, and both times you were there kicking ass. So help me, put me in your mindset when you are at a code, when you hear it, straight through the end.
When I hear it, we joke around, we call it code mode.
Oh, jeez.
So you go into code mode and you just are hyper focused. So my job on code team is to do the IVs.
Yes.
And to just assess the situation. And I'm not going to lie to you, every single time I go to a code, I'm scared.
Oh, jeez.
I am. It's a scary thing.
It really is.
And I think to acknowledge that it's scary and to not be like, no, codes, I got this. Like, don't worry about it. Like, it's a scary moment. And you have to remember that as scared as I am, I'm going to harness it and I'm going to use that energy to focus on what I need to do for this patient. And I'm going to remember everything that I was taught, ABCs, airway, breathing, circulation. I'm going to be aware of what my team needs from me. And I'm also going to remember that I'm on a team.
Yes.
I don't have to save this patient by myself.
Oh, definitely.
I am here
very scary.
with very skilled, very capable people. And I just need to listen to what I'm doing. And if I see something that needs to get done, I'm going to shout it out. And if it gets overruled by the doctor or by the charge nurse, fine.
So be it.
But this is not the time to be timid.
Exactly. And like, it's crazy because like you go to your CPR classes, right? Mm-hmm. And like, it's like CPR. Oh yeah, I'm a nurse, CPR, whatever.
Yeah.
CPR is so important. It is so important. And it's like, so I've only been to 2 codes. 1 code, I was basically just in the background, just watching my preceptor do the meds because 3 North does the med carts. But the second time I actually had to do compressions, and I was told during my rotation through the compressions, you're doing it too slow. Did you not, it's like, 100 beats per minute. Mm-hmm. So like this stuff is super important, and it doesn't matter until it matters. And when it matters a lot, like a lot. So scariest code moment, and like, I want to know, like, what did you do after that super scary time?
I think the code that got to me the most was actually a patient that I had for a couple of weeks. So I really knew him. He was a sweetheart. And so in that moment, it's no longer a code. It's someone that you care about, and you really want to fight for this person, and you want them to wake up, and it's almost like a movie. You're like, breathe. And it's just, so I think that was the code I think that I was the most nervous for, because it was someone that I had bonded with. Not to say that every code doesn't matter, but I think when you spend so much time with a person,
definitely
it's easier to go into a room with someone you've never met before and jump on the bed and give compressions, because it's like, this is just, it's black and white almost, versus you really sort of bond with someone and you really saw that progress, and it's heartbreaking.
It cannot be easy. Like, I can't imagine. And like, when I go through my report, sometimes I see patients like 95 full code, 88 full code, and you just think for just a second, like, this is a tiny lady. She's 95 years old. If I, a grown man, have to do chest
you're
compressions,
gonna
break her in half. It's hard to think. And then
I'm scared I'm gonna break them in half, transferring them to the toilet sometimes. I'm like,
just forget about doing chest compressions on the poor lady. Just like everything that has to happen. It is really scary, but you're good at it. I mean, I don't know if you consider yourself good at it, but when you go in there, you look like you know what you're doing, and it truly is impressive.
Thank you.
Thank you. And Paige was actually one of the nurses that witnessed a failed IV attempt by me. And so do you see yourself as a good teacher? Because I really, really appreciated the time that you were there with me. Do you go out of your way to do these, though, like the teaching of new skills, assignments, whatever?
I try to, but I think just how I am as a person, I'm very fast. Like my wheels are spinning at 1,000 miles a minute all day long.
Okay.
So I think I work really well with people that are fast paced like I am. But I think to people that maybe take a little bit longer to learn things, I think they get overwhelmed by me.
Yeah.
And I have a hard time slowing down.
That's you're super self-aware. That's really honest, Paige. I mean, like honestly, a lot of people just don't know these kind of things about themselves. Period. The fact that you airing it out there is kind of impressive.
It's who I am.
Good for you. Oh man, I think I'm very impressed. Like
Thanks.
honestly,
Thank you.
that's super super difficult. Even for me. So nursing goals. You said that end goal you want to be in ICU. How long do you see yourself? Like, do you want to go stay in the rehab much longer? We don't have to say dates, obviously. But do you plan on being there super long and then jumping straight into the ICU? Do you want to try hospice, maternity, peds? Like, where do you see yourself going?
I think I want to do an ICU as sort of once I've settled and I've gotten tons of experience so that when I get a patient in the ICU and it's go time, I'm not like, okay, I don't know what to do with this. So I think I definitely want to get a little bit of a PD experience in. I worked in PD for a year and a half as a tech, and I loved it. I love kids, and I thought I wasn't going to like geriatrics. I thought I wasn't going to like adults, and now I love them even more than I loved kids. The older patients just crack me up. They say whatever they want. They kill me.
They're awesome.
So I think I definitely want to get like some good med surge. Rehab's going to be great because you're preparing your patients now. Say I move to an inpatient setting on like a med surge floor and I'm prepping my patient for rehab. I know what they're getting themselves into, so I can prep them for that.
That's key.
Yeah.
Really,
I think I just want a little bit of everything. I want to be really well-rounded.
So I was talking yesterday to actually one of my nursing school friends, and she's actually at BMC, and she works in a cardiac inpatient.
Ooh, good for her.
Exactly, and it's really it's super. She's like, everyone thinks it's super intense, and I'm not general. I'm just saying this is what she told me personally. She said that like they have their own wound nurses, they have their own IV teams, they have their own respiratory teams, and she was just explaining to me like where we are at. Yeah, it might seem overwhelming and stressful, but we're getting so much experience and hands on to other stuff, which is pretty, I think, great.
Oh, it is.
She says it, but when I'm at work, I'm like, kill me.
Yeah, crying on the inside, just internally weeping.
Exactly. So so the grass is always greener somewhere else, but it is a good goal. And I was talking to Katie, and I was telling her the same thing. It's so hard to know for nursing, but the great thing about nursing, you can
do whatever you want.
You can. You have that option.
And if you don't like it, you can go wherever you want.
Amen. And that's like it's good.
It's beautiful.
It really is. It really is. So your favorite thing about being a nurse?
That moment the patient's going home and they're so happy, and they just look at you and they just say thank you and they smile and you get a hug and they're like, it makes it all worth it. It makes the frustrating family member worth it. It makes the I don't know why I can't fix your labs and correct your labs moment worth it. It makes the yes, I've changed your ostomy bag 78,000 times this week. But when they're getting in the wheelchair to get in the car and go home, that moment it makes me want to cry. Like, I love it. They're so happy, and you're like, yes, we did it.
Exactly. It really is like some of the best moments like ever, because like they give you a hug and they're smiling, and like, I don't know, 30 minutes earlier, or an hour earlier, a day earlier, they were like really, really upset with you.
Yeah.
So it does, full circle. They come in happy, they find out how tough it is, they get super mad, super upset, you guys build that bond, and then they leave and they're like, thank you you for everything.
Or when they come back and visit.
Oh,
I know.
My goodness.
And you don't even recognize them because they walk in the door and they look so good. And they're like, hi, Paige, you're not going to say hello? I'm like, who are you? And they're like, it's me, Mr. Smith. And I'm like,
oh my
no
God.
way. It's so
good
great.
for you.
Yeah.
No more faults.
Exactly.
All right. So least favorite. What is your least favorite thing?
Ugh, waking up at 5:30 in the morning.
Seriously, you gotta wake up at 5:30?
Yeah.
I'm so sorry.
I think
rough.
the least favorite thing is when you've been going and going and going and going all day, and you are exhausted, but you have to push yourself to keep going.
Yeah.
And you just have to remind yourself why you're doing what you're doing.
Yeah.
And the alarm goes off, and you're just so tired, but you have to put it in perspective and think why you love your job and why you're doing what you're doing is to help other people. So I think sort of the stress and the exhaustion that comes with nursing that I think a lot of people know about, but you don't truly experience until you're in there and you're doing 3 in a row, and then you pick up an extra shift because staffing's going to be bad. And
and like, so like, it's really hard to like just explain, because it really is like exhaustion, and you like really, really are tired. You work a 12-hour shift, and then you have 101 tasks to complete because you've just been super heavy. You end up being there for another hour and a half.
Just charting to go back home to just pass out to wake up at, in your case, 5:30. It's insane, and it's tough. It really is super and you catch yourself doing the weirdest things. Like yesterday on my way to work, I drove all the way to work and realized I did not put socks on.
Oh, goodness.
I was like, why do I feel weird? What is going on right now? No socks.
Did you use our
Yep, sure did.
No faults today.
No
faults today. So advice, and I want specifically for you to give advice to all the brand new nurses, because like I said, I see you as a super confident nurse, and it's inspirational, it's motivational, right? I want to be that confident. What do you tell all the new nurses so they can be, by the time they're having their first 1-year anniversary, they can be as confident as you are?
Don't be afraid to ask questions. This is your time. The first year is your sponge year.
Yes.
Absorb everything you can. Don't say, I don't want that patient because I've never seen that before and it intimidates me. Say, I want that patient because I've never had it before, and I'm going to learn everything that I can from this patient. So
didn't we just talk about how stressful that was? No.
Correct. but now I feel comfortable with an LVAD.
Exactly.
And I freaked out for 48 hours, and now I feel so good that I've learned that. And I can take that with me no matter where I go.
Oh, goodness.
So, and if I had avoided it, it would still scare me.
Exactly.
You got to take the beast head on, and if you absorb as much as you can in that first year, it is going to do so much for you for the rest of your career.
It is the truth. It's hard to do in the moment. In the moment, you definitely say, I have 4 or 5 other patients that I kind of like. I don't want this patient, right? But if you do take that patient, the learning curve is going to be rough. The day might be rough, but
it makes you grow.
It does. It makes you grow. You just become a better nurse every single day. So, like I ask all of my guests, thank you again for being on my interview show. You are an everyday hero, just like I believe all nurses are. But 5 years from now, when you're in the ICU at MGH, BMI, wherever you are, where you're kicking ass and you're taking over the entire unit, and I call her, I say, hey, can I please get an interview? Would you do me the honors, Paige?
Of course.
Oh, thank you very much.
Of course.
Paige, thank you. Good luck, and I will see you at work this weekend.
Oh, is it our weekend?
It is our weekend.
Great.
Great advice.